thank you very much, Sarah. I'll stay near the mic. Okay, all right. So thank you, Sarah, and thanks for the invitation, Derek, to talk here. So I'm going to really talk about three sort of areas. I'm going to give you a bit of background. I'm going to talk a little bit about where we are on the EHR journey and talk a little bit about how we move forward from here. So some of that is really centered on people that we have and the progress that we're making and the learning that we're doing on this journey. Okay, so just a little bit more background to me. As Sarah says, I'm the delivery director for acute hospitals. I live on the Wild Atlantic Way, and it's great to see some fellow Galwegians here as well. Neil from Cree. This is a picture of the national park there in Connemara. Okay, so whilst we live on that exposed west coast, we do get to appreciate some of the more refined culture on the east coast, and I spent a lot of my time here in Dublin working with various partners on the acute hospitals. Okay, the set of work that we're involved in the ICT enablement for acute hospitals, there's a couple of hundred projects, some very big ones and some smaller ones. There's a project value of around 150 million euros, a rolling project budget of that sort of order. Okay, and the EHR is a really important element of that, and indeed all of the things that we're doing are contributing towards that agenda. Okay. So just as we get into the discussion, I want to just make sure it's grounded in the experience of healthcare delivery. And just a day in the life of the HSE is really painted out here. So there's nearly 160,000 prescriptions issued every single day. Okay, there's disability assistance hours of about 12,000 hours every day. There's 48 urgent breast cancer appointments every day. Okay, now each of these initiatives and everything else that's not described here is actually supported and enabled by some underlying technology. Okay, so we've got lots of technology that helps ensure we're delivering care and delivering care in an effective and safe way. Okay, we've always got room to improve. Just looking specifically then at the acute area, this includes obviously all of the work in the publicly funded hospitals here in the country, but also the National Ambulance Service and Organ Donation Ireland and things like that. So just to pull out one of those, last year we saw 832 ambulance calls every single day. And we've had a very big technology platform introduced to support the ambulance services. So obviously the call handling, the dispatch services. We've got an incredible networked platform inside the ambulances now, and all of the emergency medicine technicians will be or are using a tablet to document the patient care. They're using an electronic record in the emergency medical technician community right now. That has been underway for about 5 years. We get to the very last of the ambulance centres in the next couple of months. They're actually coming out into the west. So everywhere, it started in the south, we've gone all through the Leinster area, and then we're just finishing out in the west right now. And the complexity of delivering that and all of the issues that arise and working those through is part of the journey that we're on. Okay, we do this journey in the light of something that's of enormous interest to all of us here. These are just the last two front pages that before I had to put the deck together. But there is rarely a day when health is not on the front page in some shape or form. And that's because we're all vested in that. And so we've got a spotlight on our work. It's because we're all vested in that work. And it's how we approach that that delivers additional value is really important, okay? Because it's important to all of us as stakeholders in the health system. And obviously it's critically important for me, responsible for delivering many of the systems that will help people deliver improved care, okay? So I just want to come in then around actually the patient records and the electronic health record and talk a little bit about where we are in that particular journey. The policy landscape is one that historically there was very little mention of ICT. There was some ICT-related papers and policy, but what we've started to see is more and more ICT enablement forming part of that policy initiative. Okay, so the trauma networks, it's embedded within that policy that we actually have ICT enablement there. The acute floor, which is a new way to handle emergency presentations, ICT is embedded within that. So we established the programs to ensure we're delivering the capabilities that will allow for that safe and effective care. Okay, it all on in terms of that ICT agenda becoming a key part of the way we deliver healthcare. It's really rooted in this paper, which was the Future Health paper. It was published in the end of 2012, but the development was a few years leading into that. And this, I think, was the first time where we saw a really coherent appreciation of where ICT can actually enable effective care. And they talk about e-health. This is probably the first time I saw the term e-health within the policy literature. Okay, and it spoke about that requirement to bring together the academic, the industry, and the care delivery organizations to actually get onto a better platform and a better route forward. And I think that what's happening here within IPPOSI is a really good reflection of bringing those multiple stakeholders together and move it forward. This was really the seed that led to some of the dialogue in the Sláinte Care committee, the Future Health Committee, that resulted in e-health being a major thread across the Sláinte Care deliverables. Okay, so this was the seed. It established the role of a chief information officer in the HSE, which brought us through into that dialogue with the cross-party committee and the deliverables that have been set out in the Sláinte Care plan. Okay, it is wonderful to have this plan that gives us a multi-year perspective and a strong sense of how ICT is going to enable care improvement and care delivery. Okay, and it is really a testament to our Oireachtas that they brought this together and pulled it off, because some of the challenges that come with different party perspectives have been reconciled in this agenda. Okay, so it's a really fantastic policy platform and implementation plan that's going to help bring much better tools and solutions for the people that deliver care. So just calling out where eHealth fits within it, there's a work stream, and under the work stream 1, which is about enabling infrastructure, it talks to the eHealth program, and there's a whole set of deliverables within that we work with Lauren McGahey in the Sláinte Care Program Implementation Office with. Okay, so that's the context within which we're working. But that context, I guess, is also grounded in all of the developments that we've been working on over many years. Okay, and I suppose I should call out the terminology. It's a really useful artifact to see this. It's very useful because I guess the language that we speak can often be somewhat confusing. I know that there was a little bit of hesitancy about what was the description for the shared care record, but whoever put that first paragraph together, I think, nailed it in one. And I'll talk a little bit about that. So I don't know that there was a need for that hesitancy, really. But what it's really grounded in are some of the big initiatives, some of the very significant care improvement initiatives that we've been delivering over a period of years. And I'm just going to talk to 2 of those examples, because these have been things that have taught us very much about how do we reach that better place for care. The first one I want to talk about is the blood track system. So this was a new directive that required traceability from donor to recipient of blood products, which came in about, in excess of 12 years ago. It was a European directive. And we've brought in a platform now which allows that traceability from the donor right through the person that needs it. And blood products are needed in every single facility, every health facility, every acute health facility in the country. Okay, so for surgical procedures, for maternity care, there's blood products right across the services that are offered. And what's happened through this tooling, which was led by Tony Finch, who worked with the Blood Transfusion Board, what's happened is we've now moved to a point where we've got one of the optimum blood product delivery networks in Europe. Okay, so every unit is traced from donor right through to its end use. There's a whole set of safety checks along the way, and that whole community of laboratory professionals that support that delivery of blood product and matching the right blood product, the right unit to the right patient, has been enabled by this platform. And there's so many safety checks along the way because it needs to be temperature controlled and it needs to be properly matched. And this, as I said, has resulted in us having an optimum blood product delivery network here in Ireland. And we've got, that network has been actually about changing the way we manage blood products. When I first started in the health system about 16 years ago, one of my early interactions with the laboratory included the person responsible for the blood bank. And he was just writing the order to the blood transfusion board, which was going to be faxed up, and those blood products were going to come down on Fast Track. Does anybody remember Fast Track? Yeah, the CIE parcel service, yeah? Yeah. And he would actually go down to the station to actually collect those blood products and bring them back. We have moved into a completely different environment now, one which is much safer for patients. And that has only happened because of the change in the way business is done. And the change in the way business is done was enabled by these technology platforms, okay? There's a new feature just coming down the track. It's effectively, for all intents and purposes, it's like a chocolate vending machine, but it's actually blood units. And this will actually further improve the delivery system for blood products and will allow for, again, optimal use and minimum stocking levels that provide for safe care. So there's some really fantastic innovation happening here, all enabled by that platform. The second one, and it's the National Imaging Platform. How many people have come across this in some shape or form? Okay, so it's one you're very familiar with. I met Neil, who, as I was on the way in, I didn't realize Neil would be here, but I did say I was going to talk about this. If I'd realized he was going to be here, I wouldn't have further flattered him, really. But what we've delivered, or what Neil delivered through the National Imaging Platform, and that continues to be sustained with a really fantastic team of professionals here, is that ability to look at those radiology diagnostics across the country. This kind of technology enablement has done all sorts of things for the radiology service, but what it's really done for the patient is it means that when a patient needs an escalation in care, the people that have got the expertise to deliver that can make sure they can see it from any facility in the country and say, yes, transferring that patient to me is going to ensure that individual gets the right care at the right time. Okay, so this, again, a very significant investment at a time when we were under the Troika, okay? But we've put in a very significant investment to put this platform in place, and it is actually transforming the experience of care for many, many patients. They're getting safer, more effective care as a result of this platform. So here's two examples of those very many programs that we have underway that are contributing towards that effective information that allows the care delivery people and the individuals that receive care to get safe and effective care at every step along the way. Okay. It's a real challenge, though, and the Robert Wachter, does anybody come across Robert Wachter? Yeah, okay. Anybody know the publication that recently came out? Yeah, Digital Doctor. Has anybody read the book? Yeah, okay, right. Really superb book about the complexity of technology in healthcare. And he has a case that threads through that story, which is really illuminating that sometimes we trade certain risks for care delivery now for new risks, and we need to be very watchful of that. But Robert Wachter was invited into the NHS to help them with their digitization agenda, really. And one of the things that he calls out in the report is that the investment can take a long time to realize value. I think NIMS and the blood track systems are probably different in that respect, in that there were some things about that allowed us to displace significant cost. Okay? But for many of our investments, it takes a long time to yield the benefits, because the benefits only come when we change the way we receive and we deliver care. Okay, and that's the way the Wachter report articulates that, I think, is really telling. So one of the things, and the reason, I guess, that Fran Thompson, the CIO for the HSE, who was very much looking forward to speaking here, he's down with Public Expenditure and Reform right now, looking for some of the additional investments that we need to be able to continue this journey. Okay, so that's the context within which we are working. Okay, we've got to make those investments. We've got to make sure the people come together, not just the technologists. And in fact, probably the technologists play the smallest role in the improvements in care delivery. What the people that receive care and deliver care can do is they can change the way they operate, that brings about new efficiencies and new capabilities and new safety mechanisms. Okay, so that's the context in which we work. And in this process, there's a lot of learning goes through. So one of the things that we identified in the Future Health Report was the need for a Chief Clinical Information Officer. Okay, and the HSE has a post there. It's just in the final stages of appointing again. Okay, and that's to actually lead out from a clinical perspective on the electronic health record agenda. Okay, and these professionals that are delivering care bring such a richness to this process, and they can focus the attention in the things that are really going to make a difference. Okay. Along with that, we're seeing a partnering with those people that are in the, those of us that have conditions that we want to get care for. Okay, I was at something that was convened with the diabetes clinical lead just a couple of years ago, and I think there's a lot of work in public patient involvement in that program, and I know that CRE facilitate much of that. But what was really interesting is the individuals in the room said, well, actually, we're the people with the expertise, the care professionals are the specialists. Okay, and so the experts are the people that live with the conditions, and the specialists are the ones that help them on that journey. Okay, and I think that we're starting to see now some additional involvement with the citizenship and the general public around that. So moving forward, and the public patient involvement, I just want to talk a little bit about what we've done so far in that. Okay, and we are. What we're coming to in the next year as well. So over the last 12 months, there's been a number of engagements with the, via the National Advocacy Unit, and we've had 18 members of a public involvement panel came together. Okay, they've been involved in a number of workshops so far, a little bit about the how we engage and how they can contribute to the EHR agenda. The persona workshop, and the personas are really these exemplars. These are the kind of fictional characters that represent how things will be different when there's good ICT-enabled tools available to the individuals and to the people that provide care services. Okay, so these personas have been fleshed out and developed in conjunction with the public consultation panel. There was a workshop held just a couple of months ago around the clinical portal, which is kind of strongly came out in support of direct patient access for the health records, and we didn't expect anything different. That's what we absolutely expected, and it was great to get that affirmed. And also appropriate sharing of that data amongst people that are delivering care in different contexts. Okay, and that again is very welcome to have that strong endorsement of sharing data where that is in the patient's interests. Okay, so they're the workshops that we've conducted. We are hoping, if everything goes well, to have a further detailed workshop on the data privacy engagement. Okay, and that's going to be held before the year end. All right, and this I think is a really important part that will help inform our roadmap. So we need to make sure that what we progress are things that are lined up with everybody's expectations about when data can be shared, how the controls and the safety mechanisms are in place so that only appropriate sharing takes place, and that's done within the context of a consultation with the public. Okay, so into next year then, we're going to be looking at the shared record, the acute EHR patient portal, and some work around the community EHR. Okay, so that's the context of the workshops that are coming up over the next 12 months as well. Just very briefly, this is the word cloud from the last workshop on the patient portal. In terms then of the all singing, all dancing solution to all of our clinical problems, EHR, what we've got what we have in flight is a program of work that was agreed by Cabinet that focuses the initial EHR deployment in the Children's Hospital. Okay, so that's what the current government focus and government priority is set out at, that we acquire an EHR for the Children's Hospital. The initial market engagement started a couple of weeks ago on that, and a procurement process is in flight. Okay, so that's where the initial focus for the acute EHR is going to be. In parallel with that, we've got a series of learning exercises where we're looking to bring through a proposal around the shared record. This is about us exposing digital data. I don't expect you to be able to read this. What we're looking at is using existing information sources that can be combined together to present a shared view of the patient's digital data. Okay? And within that, we've got a number of experiments around the clinical capabilities, which are across the top line, and then the enabling works on the bottom line. And the main part of that enabling works is that data privacy work. So what we can do, or what we have to do, is we have to make sure we stay lined up with the data privacy agenda. There are some things coming through the Department of Health in terms of a new statutory instrument that informs how patient data can be shared. Okay, so we're trying to keep the enablement and the legislation and the patient demand working together. Okay, and so this is where a lot of focus will be over the next couple of years around bringing together the information sources we have around patient data and presenting that in a coherent way to improve care. Okay, and that's largely the work that we have underway. It is clearly enabled by really good clinicians that understand the bridge between their clinical work and the ICT enablement, partnered with some of the ICT professionals, and partnered with the investors, right, the government that is a key stakeholder in this, okay? And together, we're making really good progress in some spaces. We're starting to identify the areas where additional progress will be made. But I have to say, it's an area of work that is incredibly rewarding, incredibly challenging, but it is fantastic when we see care change for the benefit of the individuals that come to us for care. And I think that's I guess the joy of working in the health system. Okay, so thank you very much.